a special person from Chicago has agreed to maybe say a few words on her particular situation, but she has not completed yet. She is still on the journey and a work of progress, but she's getting very close to it. I just heard today, it's very interesting to have these parties or my seminars when I talk to people, because even though I feel we take a rather extensive story on what has happened to them at the parties or at the few times we have these at the seminars, I'll hear other little comments that are revealing to me in different ways. This person nearly drove me crazy when she started here. And because she would ask me question after question after question, even worse than you, Jerry.
Really?
Yes. And I was like, I guess it's an honor, I guess. But when you hear the anatomy of what she had been through, you can have a greater understanding, because we did a twister on her, in that she had seen 42 previous doctors and therapists before she came here, of every type you can think of. And she had extensive diagnostic work. She did not have surgery, but she had multiple spinal cortisone injections deep in her spine and did nothing. She had multiple testing by the world's largest spinal center. It's in Chicago. I've actually taken a course there years ago, so I was well familiar with it. And somewhat characteristic of our methodology here, so she comes in, we have a pile of papers from her different tests. We look over them. And we went over her story thoroughly, and then we just did table-side examination. And I said, well, it's here in your back and here. And this was, of course, very different than what the world's largest spinal center said. It's 28 stories tall in Chicago there, all devoted to brain and spinal problems. And she said, well, they said this. And I said, yeah. And I said, well, no, you don't have that. And this is a culture shock, because you go through all this extensive testing and scan after scan and see all this specialist. You know, you kind of look for some continuity, and I just said no. But this kind of segues, before I introduce her, if she's not embarrassed to death, first. The methodology that we follow here is real new, 115 years old. But it's, and that's true. Osteopathic medicine was started by an MD in 1892. He started it when he was older than me, 58 years of age, and of course I'm many years younger than that. But he didn't start it, he didn't want to start a profession. He just merely wanted to improve musculoskeletal treatment. He was an MD, but he found he was very famous, but he got thrown out. Basically, the doctor would get the sheriff in these towns and throw him out. There would be, if there was an existing doctor, and they threw him out of every place except for Kirksville, Missouri. And he was embraced there and started a clinic and eventually a osteopathic medicine. But the technique of osteopathic medicine is to listen to the patient and then examine the patient and form an accurate diagnosis and treatment based on that. And that is amazing in itself, that osteopathic medicine has remained intact, in fact flourished, using those same concepts for 115 years. Remember, 1892, I'll give a prize for this one. When was X-ray invented? I'll give a big prize for this, whatever I can get in there that's good. 1895, Wilhelm Röntgen invented X-ray, 1895. When was bacteriology accepted as a science? 1920s. Actually, Louis Pasteur discovered bacteriology and presented it to the French medical bodies in 1860, but they threw him out. And it wasn't until about 1920s that bacteriology became accepted as a science. They had different concepts then. But what I'm pointing out is it's amazing that osteopathic medicine has survived over 100 years. Because in that time, when did penicillin come out? World War II, basically. We've had many, many things that have come out and have changed. But, and many things have gone. For example, ice boxes. They're gone. Buggy whips are gone. I can remember when I was in school, a copying machine. They were about as big as a car and cost about like a car. I mean, now we got them on every desktop, etc. Computers, when I was in school, were as big as this room, and it was like they had to have like a locked entrance in there. They were so sensitive to cold and everything, and the people that went into the room had like a tag, because this would be like going into Fort Knox or something with the computers. Well, now they're every place. Copying machines were also big, and they were messy. They were wet. There was no dry copying machines, etc. And anyway, what I'm pointing out is that we've had many changes, but the old style of osteopathic medicine persists, but it's somewhat of a culture shock as it was to this person because we just did it the old style. And in my osteopathic training, I did like yourself. I saw the medical doctors for my back pain. And there were no MRIs back then. There were no CAT scans. I had a myelogram, which is a rather dangerous and painful procedure where they inject dye into your spine and then run it up and down. But I wasn't any better. And so I sought out osteopathic medicine, and that got me on the road to healing. But I wanted to be a physician from the time I was 10 years of age, reading a book in our little school library. But when I had my own disabling pain problem at 18 years of age, and I wasn't helped by the other types of doctors, I decided osteopathy was for me. The fact that the public doesn't understand them, etc., well, that's another issue. I said, I think a doctor should help people. Now we do have an official medical doctor in our audience, so if they find that I'm saying something untrue, I imagine they will call me down. So without any, anyway, let's continue on this original story before I introduce this special person. I don't think that we've had anybody, we've had people in the 30s seeing number of practitioners, but this lady had seen 42 practitioners before she came here. And we were able to get over that hump of her questioning me over and over and over about why this and why they said that, etc. And but better yet, we were able to deliver. And she was totally disabled from her occupation, which was basically involved sitting and talking. Couldn't sit that long. But she's been back, and she's turned out she doesn't ask me that damn many questions anymore. And so we appreciate that. So I'd like to introduce you to Dr. Lynette Verdreen. How do you pronounce that again? Verdreen. That's what I said, Verdreen. Can't get my Midwestern accent. It's not Verdreen? So, an unpublished success story, Dr. Lynette Verdreen from, not Chicago, actually, Fox River Grove.
Which is closer to Chicago.
How about a big hand? So, now you get your time to double-cross me.
I'm speechless. I don't know what to say. It's, you know, the cake was, I think, what is the name? What's on the cake? Journey? Yeah. And there's another saying that's very similar to that. The journey is the reward. And that's really been the case here. It's just been a really long road. It's been a long year. This all started about a year ago. And I was to the point where I had 2 small children. I couldn't take care of them. I'd been everywhere. I'd seen, Dr. Faber was the 42nd person. And I'd seen just about every specialist in Chicago, every neurosurgeon, every orthopedic spinal surgeon. Thank God they couldn't find anything to operate on, because I'm sure they would have. But it was basically cortisone shots and live with the pain, and that wasn't something I was willing to settle for at this point in my life. So I did come and ask him probably 20 minutes worth of questions. He had to get up, to let me know that
go to the
that was
bathroom.
enough questions.
Take some pills.
Yeah. So, but I think, what I really appreciate about Dr. Faber is I think he really embodies that principle of the physician as both combining science and art, because I think he really does that. I think he's both a scientist and an artist in terms of how he treats. And I feel really fortunate to have stumbled into his care. Thank you.
Well, it wasn't really an accident.
No, not at all. But thank you
Well, God bless you. Well, thank you. And she has contributed to the new edition of Pain, Pain, Go Away is coming out. And for her little token gift, as initially I thought she was a huge pain in the neck. But if you wear this like in an airplane or even when you're driving, it's quite helpful.
Thank you very much.
You're very welcome. God bless.